So thank you very much. Let me just let me just tell you that I'm, after 3 years of this project, I'm so happy to be here and to finally be able to share even the preliminary results, which are also quite encouraging. So this is a twice, the case for happiness to share the results with you, and have your stimulating comments and feedback on this. So my job is to briefly present what we have done from the, let's say, the empirical side of the project, where we focused on collecting data among a sample of older adults in the city of Brescia, Italy, where the project was focused, in order to test some, we think, innovative hypotheses on structural effects of the social relationships on older adults' cognitive abilities. And this has been the joint effort by me, and I was very pleased to work on this with Matteo Piolato and Daniel Portolani from the Centro San Giovanni di Dio Fate Bene Fratelli, psychologist, Alessandra Marengoni, gerontologist of the University of Brescia, and of course, Flaminio Squazzoni. So we've already heard a lot about the effect of social relationships on cognitive decline, thanks to Matteo and the systematic review we have done. But let me just focus on one very small thing, which is the difference between network size and what we have called the network complexity. When it comes to the structural side of personal networks and their effect on cognitive abilities, what's been done so far by most literature so far is to focus on the network size, which is basically the number of nodes in a subject's personal network. What has been less done so far is to focus on the structural composition of that personal network for a number of reasons. One, I guess, is basically the fact that collecting data which allow a researcher to test effects of the composition of personal networks is quite difficult. And sometimes most studies have been focused on testing longitudinal effects with panel data and large samples, which are not really, which don't often allow researchers also to collect data in such a fine-grained way that that contain information about the ties between the nodes in a network. Let me just draw your attention so that my example should be more illustrative. Let me just draw your attention briefly on the two networks I am plotting on this slide. The one at the top is a personal network of one of the subjects we have surveyed during.
We don't see the plot, so you're not moving. So we see the first page.
Well, I was actually, but something's going on the screen sharing. Okay, let me try again. Sorry about that. So can you now see a slide with two networks?
Excellent. Yeah.
And can you still see if I go back and forth? Yes. Great. Sorry about that. So these are two sampled personal networks of two of our subjects that we surveyed in Brescia. The main difference between the two networks is that the first one, the one at the top, is larger than the second one. So you can see that the first one is composed by 15 nodes, which means that this subject has reported having frequent contacts with 15 different people, usually. The second one is composed by only 8 persons. Despite that, the first network is clearly structured into two main clusters, You can see that all people in the two clusters have ties with each other, so are linked with each other. This means that the contacts of this person know themselves in such a structured way that it's composed by two clusters. While in the second example, we have 5 people who don't know each other. 5 contacts of this person don't know each other, while the other 3 do know each other. So the question here is, what we know from the sociological research on the structural composition of personal networks made us hypothesize that network complexity rather than network size could have an important effect in protecting older adults from cognitive decline. And this, of course, I mean, by this we were following on the footsteps of important studies such as the one by Lea Elbert, whom I'm very pleased to have here, on the Dutch population, and another study already cited by Matteo by Ali and colleagues in 2018 on the US population. What we have tried to achieve was to get more deeply in measuring network complexity. And we could do this because we had the possibility to acquire data about the ties between the nodes in each personal network. The reason why we think this is relevant, the complexity might be more relevant than size, is mainly twofold. First of all, we know that our personal networks as human beings are roughly structured around what we call social foci, so which usually relates to different social situations where we interact with different kinds of people. So each social focus might entail different cultural values, might entail different social norms, and people are then required to behave in a different way across different social foci. And this is something that could have an impact on the way people then use their cognitive abilities to switch from a social focus to another one. And another main reason is that from a purely cognitive point of view, information flowing within one cluster might get redundant, while if an individual interacts with people from different clusters all the time, is then exposed to different kind of information, which has an interesting socio-cognitive impact from one side, but also from I would say from a preventive medicine point of view, it's also interesting because more clusters means that more people coming from different backgrounds have the possibility to understand if an older adult individual is at risk of being cognitively impaired. So with this in mind, we have surveyed the population of Brescia, of older adults residing in 3 neighborhoods of Brescia. We chose to do it in 3 different neighborhoods because another leg of this project is about estimating the geographical infrastructure of social support and the effects on cognitive decline. So we had the possibility to acquire a random sample. We sampled subjects older than 74 years old. And in the end, we acquired a total sample of 232 subjects, which means 232 different ego networks, different personal networks, all with what we call alter-alter ties, so all with also the relationships between the subjects' contacts. Part of this sample is effectively a random sample because this was the initial target of the project. We started with a target sample of 851 persons. We could enjoy a participation rate of 13%. Of course, we had some difficulties in data collection due also to, as you might expect, and also as Flaminio has anticipated before, and also Marco, due to the COVID-19 outbreak during March of last year, which hit the Lombardy region where Brescia is located particularly hard, and Brescia was also one of the hardest hit cities in Italy. So then we also had to rearrange data collection, and we switched to a non-probabilistic sample, and we could acquire other 125 subjects. And we finished basically last month. So at the end of April of this year, we were able to finish the data collection with a total sample of 232 subjects. Okay, sorry. Just a few words of about the name generators we use to acquire these fine-grained network data from our subjects. You might be familiar with the ego network research design. This is achieved through what is called the name generator, which is a set of questions which are posed to the subjects, in our case by a team of five trained interviewers via personal administration of the questionnaire. And one of the most interesting, one of the most important and crucial things in collecting data of personal networks, especially with older adults, is to let people recall their contacts. So we help them by structuring the questions so that they could easily understand the social foci, the different social situations where their contacts could come from, and we did it in like with a series of circles of increasing extensions, starting from household members and then switching to children and their partners, and then other relatives, and then neighbors, former work colleagues, and then contacts from civic organizations until other friends or acquaintances. And then we were also able to weight the ties between the ego, between the subjects and their contacts on a 1 to 8 scale according to the frequency of their contacts. And then, of course, at the end, we asked the subjects to report whether his or her contacts knew other people in the network, and to report the names of those people. So in the end, we acquired this, what you can see on the left side of the slide is one of the largest and also quite well clustered networks of one of our 232 subjects. So let me briefly show you.
Yes, Fede, please
results.
Try to speed up because we are running out of time. Yeah.
Okay. So this is basically this is how we measured cognitive abilities of our older adults. We used the mini mental state examination, which is a well-established measure to measure cognitive abilities from a scale to 0 to 30. You can see it's unsurprisingly negatively skewed. We have a median of 27 over 30. And this is the main predictor that we measured. So how networks are structured in terms of complexity. And we used one of the best established measures in the network analysis literature, which is the number of subgraphs. So how the network is structured into subgraphs, which are highly connected inside, but not very well connected between each other. And we did this by running the well-established curve and Newman algorithm. So you can see that most people have at most 2 subgraphs in their networks, while there is a small minority of people with 3 or more, 3 to 5 subgraphs. And this is the only preliminary results that I can show to you. As I was saying, we started analyzing data just a few weeks ago. So what I have is a basic ordinary least square regression model of the mini mental state examination. The interesting thing is that results are quite encouraging. The model is quite simple, but still give us clear and significant results. Let me just draw your attention on the first predictor on the top, which is the number of subgraphs, which has a clearly positive and significant effect. So according to this model, an increase of 1 subgraph in one subject's personal network means an increase of 0.65 as an expected value on the mini mental state examination. Of course, I wouldn't spend too much time in predicting results from this model because it's a very simple one. But still, results are encouraging because this is significant, and we also controlled it by for age and gender and education and the basic socio-demographic characteristics that we have seen in the literature so far. Let me just, as a very final comment, let me just draw your attention on the network size effect instead. So the effect of the size of the network, so of the number of persons that our subjects are in contact with, doesn't have a significant effect. So the effect is almost null, while the effect of the number of subgraphs in the network is clearly positive, which gives us, encouraging energy to go on analyzing the data and finding, of course, more sophisticated ways to model the data. I'm very curious about your comments on this and your suggestions. But yeah, we're very confident in that our hypothesis could be confirmed so far. So thank you very much for your attention.
Thank you, Federico. Thank you very much for these reports on our study. So we have a couple of minutes for question discussions. If you can remove the screen, Fede, so that we can see each other. Okay, do we have any feedback, question, comment? Although it's very preliminary, but
I have a question. I'm sorry. I'm using the Meet using from the web and not from the. I haven't downloaded it on my computer, so I cannot try and raise my hands. Thank you, Federico. I have a question concerning the data collection. So my understanding is that you switched from probability sample to a non-probability sample. So I wonder, how actually can you combine the different data sets that you got? And also, I wonder whether you also changed the mode of data collection. So maybe you switch from face-to-face to, I don't know, telephone, web, or I don't know what kind of mode, and whether, you control for that, whether you think that that might have an impact on your results, because there could be, different sources of measurement error. Thank you very much, Federico, and thank you.
Thank you, Manuela, for the questions. Fede.
Thank you, Manuela. These are two very interesting points, which touch on the key issues of the data collection. So first of all, yeah, we did switch to a non-probabilistic sample in order to enlarge our sample, but we're quite confident of the fact. I mean, since we don't have, since our aim is to test the effect of the number of subgraphs on the mini-mental distribution, and this is not really a let's call it like a prevalence study, so we don't really aim to generalize our results to the whole population of older adults in Brescia. Then we think that this might still be a safe analytical strategy, so that our results could at least tell us something about the effect of the predictor on the outcome. Concerning the mode of data collection, yes, we did switch to a telephone data collection. I wrote it on the slide, but I didn't have the time to mention it. Thank you very much for letting me do it. Over 232 total interviews done. We have made 37, so almost 15%, 37 interviews via telephone. We did control for it, and it didn't have a significant impact. So our results so far are robust, but let me stress again that this was a very simple model. So I hope they will still be robust.
Yes, and in general, it would be nice to see also in other research how much the pandemic has affected the data collection and pushing people to mix and adapt. There will be a kind of very, long-term consequence of the pandemic in terms of the quality of data collection in social research. That's probably one of the points to discuss in the next years. Any other question?
I have a question for a very interesting study. Thanks, Federico. Super interesting. This idea of going a bit more in depth into what is a social network into the qualitative aspects. Is it the size? Is it the structural complexity, as you were saying? So I really, really liked it. I was wondering, thinking of how we intervene, because at the end we do this research because we would like to intervene and think of interventions that could improve people's social networking. How are you thinking? How do you think interventions would differ if we focus on the complexity rather than the size? You know, is there actually any difference? Have you thought about that?
I have. Thank you for this very interesting question, which also lets us reflect on policy issues. I have. My point is that I can't think of a very well-defined short-term intervention because you know, personal networks are structured across the whole life course, especially on older adults. One thing I'm thinking of is that we should maybe try to find policies that lets people can access different sides of our territories, of our cities, of our neighborhoods, so that they can be exposed to people from different social backgrounds and in a very short way make our cities and our territories more inclusive for older adults. But that's all I can think of with these preliminary results. But thank you very much for this question.
Thanks to you.
Okay, thank you all for this interesting question. And well, now
I do have another question.
Nico.
If I have time. So can you hear me?
Yes, we do.
Okay.
It's time that we don't have, but anyway, be short. Okay.
Okay, I will be. So thank you, Federico, for your presentation. I guess that one of the critical points of the data collection phase is probably the collection, the collection of alter ties, because reconstructing such an amount of relationship always requires a relevant cognitive effort by the respondent. So probably the completeness and the quality of the data might depend on the actual cognitive status of the respondent. And this might have some kind of implication probably on the overall analysis, namely that the capacity to reconstruct the ego network might probably depend on the mini-mental status of the respondent. So my question is, how do you deal with this kind of potential bias, and if you agree with that? Thank you very much.
And that was the question that Amaya raised in the first presentation about the causal relationship, the direction between these two. Yeah.
Yes. Yes.
Yeah. Anyway, Nico, thank you very much for this. This is a very important point, and will be part of our discussions in the closing and discussion session in the paper. Yep.